assessments for this can give us clues for the patient's overall health.
Hi, I'm Sarah Saleh Bacos from Southwestern University FINMA, BSN 1A6. Today I'm performing the return demonstration of the Neurological and Musculoskeletal System Assessment. So first things first is I will be identifying my patient using the two verifying way. So first is my patient's name and DOB or date of birth. So ma'am, may I ask your name and your date of birth, please?
So I am Adeline Nelson Montañado. I was born on January 30, 2005.
Okay. After that, after identifying the patient, we'll be now explaining the purpose of the assessment. So the purpose of this assessment, ma'am, is to check your overall neurological and your musculoskeletal system, and then I'll be checking if there are any discrepancies or abnormalities of your extraarticular and your tendons, ligaments, bones, and your bursitis or bursings. After that is I will be letting the patient to ask any questions. So do you have any questions for me? Okay, so in explaining the purpose of the procedure, this promotes the patient's understanding and cooperation to the procedure. It also alleviates the anxiety of the patient by informing the patient of what the patient should expect with the procedure. Next is I'll be performing the hand hygiene. This is to prevent the spread of any microorganisms or the spread of hives or hospital-acquired infection, and also to protect myself and my patients. After that is I'll be providing my patient their most deserved privacy. I'll be closing any doors, curtains, or windows. After that is I'll be assisting my patient to undress and if they need any assistance and give their patient gown. Do you need assistance with your patient gown, miss? Okay. If the patient needs any assistance, then I'll happily help the patient. In helping the patient, I am ensuring my patient's privacy and dignity. After that is I will be surveying my patient's overall hygiene and physical appearance. I will be noting any discomfort, disorientation, or any swelling or any droopiness or asymmetry on my patient. Also, this is to check my patient's posture or gaits. So there are many gaits, abnormal gaits. So I'll be giving examples such as waddling, scissors, short leg, and scissors and more. After that is we'll be starting with the assessment of the neurovascular assessment. So this is the purpose of this assessment of the system is to check both of my patient's nerve and blood vessels. So first things first is I will be checking my patient's mental status. So in checking my patient's mental status, I'll be evaluating my patient's orientation to PPT. PPT stands for person, place, and time. So for person, I'll be asking my patient, do you know your name or do you know who you are?
Yes.
May I know your name?
Yes, Adeline Nelson.
Okay, for place, I'll be asking my patient if they know where they are. Do you know where they are? Where you are right now? Of what?
Southwestern University.
Okay, and for now, I'll be checking for the time. Do you know what time it is?
2:30.
Okay. After that is I was checking my patient's orientation using the EVM or the eye opening, verbal response and motor response. So for EVM, E's higher score is 4, for V is 5, and M is 6. And for the EVM is I'm using the guiding scale of the GCS or the Glasgow Coma Scale, which is used to check for the level of consciousness of my patient.
Next step is
Mabalin
to
ko.
evaluate for the patient's level of consciousness. So the level of consciousness of the patient has 5 levels, which is first alert, second lethargic, third abstination, fourth stupor, then fifth coma. Then coma has 2 types, which is the light coma and the deep coma. So in assessing my patient's level of consciousness, I will be using the EVMs of GCS or the eye-opening response, the verbal response, and the motor response of Glasgow Coma Scale. So the Glasgow Coma Scale has normal levels of 4, 5, and 6, which is the eye-opening 4, verbal response 5, and the motor response 6. So as for my patient, I will be assessing my patient's eye mobility or eye movement for the eye-opening response. And next, for verbal response, I will be asking my patient if he or she knows what year is it. So sir, may I know what year is it right now? So as for my patient's motor response, I will be asking my patient if he or she can wiggle or do this or follow my command.
Can you wiggle your hands? Yeah, because it's a look closer. Not the ring? Oh, do not. Dito. Diba, sige, classmate. Oh, wait, siya. Dali, ikaw, sige nga, magkakaroon mo. Buday, ayaw, tignan kayo, wag mo gusto mo kasi tingnan ka kung siya na inlay monster. Siya. Ang tingin ito, shake na kanya siya. Shake. You naman dito siya maghatag ko lagi, but if your patient doesn't understand, you have to give the layman's term. But what if babe, that patient or do, can you follow me? Okay, can you mahimo niya ng zero.
Story na naman.
Oh, yeah. Ako ko siya kaon sa naman.
Wala mag-effort ako.
Matumpak, next.
So next is we're going to access the patient's memory by asking the patient to recall immediate memory or past memory by simply asking the patient what they ate for dinner yesterday or what was their memorable memory. So
What's the first thing you did when you wake up? May I ask where you graduated elementary?
So I graduated
Videographer, at least libaw siya siya taong gabi.
the patient is alert.
Alert, awake, enthusiastic. What's up with the 3 C's? 3 C's.
Conscious,
Unconscious na. Conscious. Ha?
Saan 3 C's?
Conscious, coherent,
Coherent.
cognitive.
Coherent.
So by assessing the patient's memory, we are actually identifying if the patient has any signs or symptoms of memory loss diseases such as Alzheimer's. Now when remembering Alzheimer's, there are actually 10 signs which are the getting lost, losing things, losing track, forgetting self, poor judgment. There is abstract feeling, there is mood swings, personality changes, growing passive, and also
Losing track.
losing track.
Not 10 over 10. 10 over 10 full time. So does that mean that I have Alzheimer's? Sige. Butang ka 0 kayo. Do you agree that Alzheimer's is hereditary? Hereditary.
Yes.
Family, yes. My grandmother had Alzheimer's. Hereditary siya. Kasagaran ng mga niyulipod. Sige.
Okay.
Sa asa mo daw ika.
Ako daw. Okay. Next is I'll be providing my patient a proverb and I'll be asking my patient to explain that proverb. So ma'am, my proverb for you is many hands is better than one. Can you explain that for me?
So it means that people must unite to accomplish one goal.
Okay. In assessing the my patient's abstract reasoning, I'm actually assessing my patient's cognitive function.
Next is we're going to evaluate the patient's level of understanding, through spoken words and written words by asking the patient if he or she can read or
Okay, your oral phenomenon. Can you hold your ear? Okay, and then hold it up. Yeah. Okay, and then can you read this? Okay.
So now we're going to be testing the patient's brain motor function. So first, we're going to test the patient's first brain motor, which is the olfactory. There are actually 12 brain motors, which I'll take the number as O to touch and feel very good vegetables. Very good vegetables, which are the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal.
Di mo mga singers.
So I remembered my cranial nerves using a mnemonic using the OOO to touch and feel via good vegetables. First is we have the olfactory followed by optic and then the oculomotor. And then after that is the trochlear and then trigeminal. After that is the abducen. After that is the facial. And after that is the vagus. And after that is the glossopharyngeal. And then after the glossopharyngeal is we have the... after that is we have the accessory nerve or the spine accessory nerve. And lastly is the hypoglossal nerve.
So, to assess the first cranial nerve, we are asking the patient to close their eyes, clear to one leg, and then have the patient identify
You include one of your
different
nose.
scent.
Okay, you identify this scent. Okay, include the other nostril. Identify.
So, luckily, my patient is able to identify different scent, but if not, this may indicate that the patient has anosmia, which means that the patient is unable to identify scent.
What can you know?
First, olfactory.
Okay, now we are going to test my patient's accessory muscle, which is the 11th spinal nerve. So ma'am, I'll be placing both of my hands on your shoulder and can you shrug against the resistance, and the resistance is me. Okay, more? Okay. After that is I have felt my patient's movement on their shoulders. This muscle there are 3 accessory muscles. Firstly named off is the trapezius, which is here at the shoulder. Next is the sternocleidomastoid, which is right below the ear of the patient. And then lastly is the scalenes, which is connecting the collarbone and the neck of the patient. Next is I'll be testing for your trigeminal nerve. The trigeminal nerve is the 5th cranial nerve. So I'll be placing my hand on your cheek, and can you push against the resistance? And again, the resistance is produced by me. Okay. Okay.
now we're going to proceed in assessing our patient's accessory muscle. We're going to tell our patient to put his chin on
This action is called flexion.
mother's side.
Can you
Here.
put here?
This is also is,
This action is called the lateral movement of the hip back.
This is
Okay.
reflection.
This
Flexion, hyperflexion, then lateral.
ikaw naman.
Okay, so next we're going to assess the patient. So
Paano ba itong bed?
Yes,
Ikaw. Oh, so di ano mo.
Kato din kuan day. Kato sa arms. Katong sa graffiti siya.
Day, ano ka do? Stereo.
okay, so now we're going to assess the patient by asking them to close their eyes and then open their palm, both of their palms, and I will
Use a
place
banana
an
hand.
object in one of their palms and ask the patient to identify the object being placed on their palm.
Thank you. And then this one.
Very good.
Okay.
Now do this one. So by doing this, we are actually testing the patient's diagnosis, which luckily my patient can identify the objects being placed in the hand. And if not, the patient has diagnosis, which means that the patient is unable to write the words or identify the objects being placed in their palm.
Okay, after that is I will still be asking my patient to close their eyes and supinate their palms. Face your palms upward. And in this test is I will be writing a one-digit number on my patient's palm. This test is called the graphesthesia. So the graphesthesia is a test where the brain of a patient can make sense of any symbol or number that is written on their palm using their tactile sensation without them seeing the number. Can you recognize this number? Okay. This number? Okay. As my patient demonstrated that as my patient said that I have just demonstrated the numbers 4 and 2 and on my patient's hands, which means my patient is positive for graphesthesia, and the loss the normal deviation or deviation from normal for this is the graphesthesia, where the patient cannot define or make out a sense of the symbol or number that I'm writing on my patient's palm.
So now we're going to proceed in identifying the patient's deep and long reflex. So first, we will be assessing the patient's brachioradialis or the patient's wrist, which is the cranial nerve 5 and 6.
Can you relax, please? Can you remove your watch? Wala lang, wala lang. Can you relax your arms, miss?
So now we're going to assess we are going to place our finger over the epiphyseal area and tap using the reflex hammer. Or actually,
Relax, please.
C5 and 6.
Next is I am now going to check for the triceps reflex of my patient by placing my finger over my patient's triceps. So I'll be holding my patient's triceps here. Can you relax, please? Okay, thank you. Placing my finger over here and then tap. For the triceps reflex, I am testing for the C7 and C8. I'll be checking for the C7 and C8 nerve of my patient, and I can see my patient's triceps reflex is intact for the C7 and C8. which is normal. For the normal finding is +2.
So the next step, we are going to assess the patient's pathology characteristics, which is the L2, 3, and
Yeah, so
Can you please relax, please?
gay actil made. Ay, ang back eh. Dili ka naman na yung space.
So now we're going to test the Achilles tendon. So okay, then we actually test.
Mana?
But we will actually test the S1 and S2.
Can you relax, please? Can you relax?
Okay. Paano siya ibalik daw kay na? Sa'yo siya kanina. Sorry. Okay, SM lang tawag ka sana. I don't know.
Okay na? Okay na? After that is I'll be stroking my patient's sole from their heel up to their big toe. This test is called the Babinski test. Can you relax, please? Relax. Relax. Okay. So for the normal findings for this, for babies or infants, the normal for babies and infants, their toes goes dorsy, and then and their toes goes dorsy means fanning out. That is normal for them. But if their toes goes plantar, means there is a problem with their cortical spinal tract. Where is the involuntary movement, which is responsible for the involuntary movement. And then for the adults or average or normal adults, the normal is plantar or the curling up of the toes, while the abnormal is the dorsiflexion or the fanning out of the toes.
so we're going to proceed in assessing the patient's dorsiflexion
Wala mo
and
di pa gusto na siya.
by telling my patient to resist the
Ay, lusod na lang ko.
to put a force against
the leg.
Please, can you do this too? Do this. Okay.
Cairo.
Again. Can you point down your toes? Point down, please. Okay. Point down. Okay, thank you.
So now I'm going to assess the patient to a standing position, and then ask the patient to walk. So first, walk from toe to heel.
Your normal walk.
So as we're observing the patient's gait, we are actually waiting for any abnormalities in their gait, such as squatting hyperemesis, explosive, stepping, waddling, and also short leg and survey.
Okay, after that is I am now going to proceed with the Romberg's test, where I'll be asking my patient to stand with their feet close and then closing their eyes. And you put your hands here on your sides. And I'll be partially wrapping my arms around my patient in case my patient falls or becomes imbalance. So I did the test for 20 seconds to check my patient's balance and coordination without them seeing their place or their surroundings.
Now we're going to proceed in assessing the patient's musculoskeletal system by telling my patients to extend its arms and doing a supination and flexion.
I'll be testing one by one and then both of you. Okay?
Faster, Maddie, faster.
This is supine, this is pronate, supine, pronate, supine, pronate.
Resist my opposing force. So by doing this, we're actually testing the
Can you sit down? Okay, I'll be doing both. After that is I'll be inspecting and palpating my patient's hand, wrist, elbows, and their joints. First I have to keep in mind to inspect first following the IPPA, but for this we're just going to use the INP, which is inspect and palpate. So first I'm inspecting for any redness, swelling on my patient, and after that is I'll be palpating my patient. I'll also be palpating for temperature of my patient. I'll be checking for any extra-articular abnormalities such as for their bones, tendons, joints, and my patient's arm. And I'll be checking if there are any bursitis, tenosynovitis, and tendonitis. So after that is I will be asking my patient to do this. This is called the Fallon's test. This is to test if my patient have the carpal tunnel syndrome. So I'll be asking my patient to do this for about 20 seconds. Okay, should be fair. Okay. And if my patient complains any tingling, then my patient might have the carpal tunnel syndrome. And the other way to check for the carpal tunnel syndrome is I'll be having my patient's wrist, and here I'll be checking for my patient's carpal tunnel. This test is called the Tunnel's test, and I'll be tapping on my patient's wrist 2 times. Do you feel any tingling sensation? Okay.
Now I'm going to tell my patient to sit. Then
So, I'm going to ask the patient to abduct their one
And after that is I'll be asking my patient to straighten up their knees, in a straight line, and then move their legs in a lateral and medial. This is to check if this is to assess my patient's SWU-CN nerve, and if to check if their lower back or their sacral part is painful or hurting.
Next is we're going to tell our patient to sit down and raise its legs and thighs. Then tell the patient to resist. Check for patient's strength.
Si Madi.
Kitas mo ma ako.
Madi, apating workout niya Madi.
Fun. That was just...
So now we're done assessing the neurological and musculoskeletal system, and now we can proceed with the after procedure or the aftercare for the patient. So we're going to assess the patient to a comfortable position, and then perform hand hygiene, and then document any findings of the assessment.
So as for the after procedure, after the assessment of the neurological and musculoskeletal system, I'm going to assess the patient in a comfortable position. Then after is I will be performing hand hygiene to prevent the spread of microorganisms again. Then document the findings of the assessment. That will be all for the determination of neurological and musculoskeletal systems.
Okay, after performing the neurological and musculoskeletal assessment on my patient, I am now going to proceed with the after procedure. First is I'll be ensuring my patient is in a comfortable position. And as a nurse, it is one of the cardinal rule as to keep the patient's privacy and keep them comfortable. And then after that is performing hand hygiene. This is to prevent the spread of any hospital-acquired infection or the hives, and also to protect myself and my other patients from the spread of microorganisms or infections. After that is I'll be documenting all of my findings according to the hospital regulation, because no timely findings or no timely documentation means the assessment should be done again.